I'm Kathy Stahl, a managing director and partner at PIMCO, also a member of our foundation board. And PIMCO is a proud sponsor of GFN, and we're really thrilled to join you today for the virtual Fbli. We're excited to have over 150 people from 45 countries joining us today. And our hope is that programs like this will aid in keeping the GFN network connected and provide additional support to the food bank teams around the world. To begin today's program, it is my honor. I'm very lucky to be part of this, to introduce our keynote speaker, Dr. Murabit. Dr. Murabit is the executive director of Phase -1, and she's also a global sustainable development goal advocate. Following Dr. Murabit's remarks, we will take questions from the attendees. So I encourage you to submit your questions using the Q&A box at the bottom of your screen. We will do our best to get to as many as possible. Now let's start our program and welcome Dr. Murabit. Dr. Murabit, I will turn the program over to you.
Thank you so much, Kathy. Thank you for that wonderful introduction, and thank you to the Global Food Banking Network for this incredible conversation. When I was first reached out to about what we would really be talking about today, the conversation obviously surrounded the impact of COVID, as we would expect. It has been a 2020 that I think has taught us all the importance of primary healthcare and pandemic response. And it's also taught us, I think, how incredibly powerful healthcare is in terms of how it intersects with everything else. So when we look at poverty, or we look at inclusion, or we look at education, I think we now all very intimately know, no matter where we are in the world, how much healthcare shapes our ability to be able to participate in life in other ways. And having healthcare, although it is treated as a privilege, it shouldn't be. It should be seen as a right. And so recognizing some of the challenges that we do have in our existing healthcare structures, recognizing the challenges that came up this year that we've all experienced and are living through, we have to ask ourselves, what has happened this time when it comes to the way in which we can ensure even our families have something to eat, right? Or the decisions we make about whether or not we're going to go out and work, if it could potentially put us in harm's way. And what does that mean for the future as we look at the reality that, I mean, there's a lot of political talk about looking more internally as countries. And the reality is that's just not going to happen. Viruses don't stop at borders. They don't ask permission. They don't need customs forms. So as long as we're part of a global community, and as long as we have a global economy, we need to be realistic about what we're looking at and the chance that something like this can and will happen again, and how we can be more prepared. So I'm going to start by giving a little bit of an overview of some of the work that we've done during COVID, during this pandemic and before, and why I think it's really important for us to center this experience in some of the same health crises and pandemic crises that have come before. Recognizing they've never been on this level of global scale, but that oftentimes history is cyclical, and we can learn a lot from what we've done in the past that was right and that was wrong. First and foremost, when COVID broke out, when the COVID-19 pandemic started back in March, when it became publicly a point of kind of public issue, and people began to recognize the severity of what was happening back in March and April, there were immediate assumptions that it would pass quite quickly. And so people really started looking at, okay, in this kind of 5-10 weeks period, in these 2 to 3 month period, what can we do to almost, and I jokingly say, kind of white knuckle it through this pandemic, right? We'll close down schools. We'll donate to our local food banks. We'll all stay at home. We'll work virtually. We'll disinfect everything. We'll buy as much sanitizer as we can. It was really people saying, okay, what can we do right now to help us most effectively wait out the time, because there had been an assumption that, okay, by summer it'll get better, right? We heard that predominantly from a lot of our politicians saying, you know what, don't worry, the warm weather will make it better. And leading epidemiologists and doctors were saying that's not the case. They were quite clear and quite frank in saying, we need to be prepared for the long haul. We need to be prepared for up to 18 months, up to 3 years. And we need to recognize that this is going to be an ongoing challenge for things like our school systems, for things like child abuse, domestic violence. There was a recognition, you know, gender norms and gender equality. There was a recognition very early on that in the past, pandemics and health crises have had that kind of impact on society. And so we fast forward now to late October. And I know I'm preaching to the choir when I talk about the impact it has had on child hunger, child abuse, and poverty. We know full well that this pandemic is, you know, testing particularly families that are low income in a way that nothing has before. We know full well that parents are having to actively make a decision about whether or not they go out of their home to work, and recognizing the risks that it would mean bringing the virus back to their family. We know that parents have to make a decision about whether or not they're going to send their kids to school, if those schools are even open. We know a lot of parents have had to make a decision. About 60% of people who have quit since the beginning of the pandemic are women. And that choice has been made because they often feel like they have to fulfill those familial duties at home to take care of their children, because things like daycares and schools have been shut down. We know that domestic violence rates are surging. We know that child abuse is surging. We know that all of these things remain true, and yet we still don't necessarily have a resolution to the pandemic. We know we're all waiting for a vaccine. We're really doing our best at this point, I do believe, to socially distance, to wear a mask, to take the precautions that healthcare, you know, experts have really stated. But we are, you know, and my father kind of jokes about how difficult it is to be in limbo anytime, a global pandemic or not. It's very difficult for you to be told hold for months at a time. And that's kind of what's happened here. So what are some of the solutions? What are some of the opportunities that we do have? I think first and foremost, this won't be, in my view, the last pandemic. It definitely isn't the first. In the past, we've had more localized and regional pandemics, but they've been completely devastating for the economies. They've been devastating. I mean, if we look, for example, at the Ebola pandemic of 2014 in West Africa, the economy still hasn't come back from that. It decimated the community, and it was a much more infectious and a much more fatal disease. And so I think we have to really recognize that a lot of what's happening now has happened in the past. And it will continue to happen in the future unless we really strengthen our health systems, and unless we strengthen trust within our health systems, but also unless we create genuine and sustainable approaches to things like poverty, food security, and gender equality. They can't be caveated based on our security situation or our health situation. We have to prioritize those within health budgets, recognizing that that is going to be what dominates most of our political and social discourse in the next few years. So given that, you know, we have 150 participants from around the world who have all, without a doubt, experienced this pandemic similarly but different, depending on your own personal experiences, and have probably seen some of this happening in their own communities. The number one recommendation I give at all points, and the number one thing I think we now collectively appreciate as a global community, is there is a limit to what politics can do. There's a limit to what leadership on a national or regional or even municipal level can do. There are always going to be communities and people who do not get seen and who do not get supported. And I do believe it's our responsibility as people who recognize that there are families that are not being fed, that there are people who do not feel safe at home, that there are, people who have to make an active choice between making an income for their family and keeping their family safe. That as organizations, as companies, and as a community, we stand up and we say, okay, how can we support you? How can we create something that is sustainable, that can continue to support you and your community through this? The Food Banking Network is a wonderful example of that, of saying, regardless of what else is happening, our number one priority is to ensure that nobody goes to sleep hungry. But we can also relay that into other things. We can also look, at our schools and say, what is it that you potentially need? Do all of these kids have equal access to technology? Can all of them equally tap into these virtual opportunities? We can look at our workplace and say, okay, am I seeing more women quit lately? Am I seeing a difference in the way that we're looking at gender now that, there are familial responsibilities at home? Kids are at home more. Am I seeing a difference in treatment when kids come on the camera, depending on who I'm speaking to? I think where it all always starts is at home. It is our base responsibility to say, what is happening in my community and how can I support it? Now, I know I'm coming to time and I'm going to head to questions in a minute, but I'm going to quickly close up on one important detail. As high-level commissioner on health, employment, and economic growth, I've spent the past 5 years looking at the very intimate connection between health and economic growth. I think it goes without saying, especially after this pandemic, that healthcare has an outsized impact on economic growth, both in the positive and in the negative. In the case of this pandemic, obviously it has halted the global economy to a degree. It's also kickstarted different sectors of the economy in different ways. And I think one thing that will remain true in all of our various fields, regardless of where we work, is that people, all of us, and the best example I can give is, CEOs who give wellness benefits. If you stay healthy, because they know you're going to be more alert. They know you're going to show up for work more regularly. They know you're going to be more engaged and you're going to deliver more when you are at work. That's something we've known for a very long time. And so it shouldn't come as a surprise to us that when people don't feel healthy, they don't feel like delivering their best. When people feel insecure about their own personal health and security, it's difficult for them to come into work with the same level of excitement and dedication and passion. And this past 7 months has been for many people a constant health challenge. They wake up every day. For some, it's really tapped into those bigger insecurities of whether or not they do feel safe and secure in their work environment if they still have to go into work. For some, it's tapped into the privilege that we have in our society. If they hold a service job and they have to go into work to support others who may not be reciprocating by wearing a mask or by social distancing or by also protecting them. So the second thing I'll really touch on is we'll hear a lot about the economy. We'll hear a lot about it now. We've heard a lot about it for a few months. We're going to continue to hear a lot about it even until we get a vaccine and after. And the truth is, healthcare and the economy have always and will always be intertwined. And it's a false, I think, it's a false equivalence to say that we really need to focus on the economy instead of focusing on really ensuring people are safe and healthy and fed and secure, because it doesn't matter if we started investing all our resources into kickstarting the economy. If people don't feel safe, if people don't feel healthy, they won't participate. And so the priority really does need to be and should always be on the people we live with in our communities, the people in our families, our school teachers, our local physicians, our local service workers. The priority really should be that we protect one another, because the economy will always be there. And so I really just want to emphasize that, because I know that that's been a conversation we've been having a lot. And when it comes to all of the issues we're talking about, from global poverty to gender equality, I think to the long-lasting impact of health on economic growth and on employment, we have to recognize that history has already shown us this. When we take pandemics seriously, when we respond adequately, then the economy comes naturally over time. It rebounds. But if we can't do it the other way around, we can't build a healthy economy from sick people. It just doesn't work. So I will turn over to questions now. Kathy, I believe you have some.
I do. Thank you so much, Dr. Murabit. And thanks to everyone for those who have submitted questions already. A reminder, you can submit them at the Q&A function on the bottom of your screen. So that was great and a good overview. I want to start maybe at a high level. You talked about a lot of issues a lot of people on this call are trying to work to address: global poverty, gender equality. We didn't talk about the environment, but that's another kind of point of intersectionality, to use one of the terms you used earlier. COVID is obviously an ongoing situation. How do you think this is going to impact the long-term, the secular goals that we've all had, especially around the SDGs? Can we actually achieve them by 2030 when we have, to your point, like lots of roadblocks hitting us on some of the underpinning issues?
I think that's a wonderful question. It will always remain true that different, and we'd always said the SDGs are a lighthouse. They're a framework, they're a lighthouse. That doesn't mean you're not going to hit an iceberg here and there. And that's going to require all hands on deck, but it does mean that you have a long-term vision of where you need to go. And I think, if anything, to me, the SDGs, the purpose behind them and the aspirations of the SDGs are so much more important than they have ever been. Because I do think what can and potentially will happen on a global level is we're going to suddenly become very distracted by global pandemics. And everyone and their aunt and uncle is going to start focusing on global health and saying, okay, that's our priority. Let's put some, let's put some money into that. Let's really fortify ourselves. So in case there's another pandemic, we're safe. Let's really build out our tech so that in case our workers all need to be remote. There's definitely going to be some protective blowback from this pandemic. And that does mean there will be less resources going into things like poverty and gender equality and sustainable cities and climate change. And we have to recognize that we can't simply build up when it comes, if COVID has taught us anything, it should be that healthcare does not exist in its own silo, that we have to look at the impacts on gender. We have to look at reducing inequalities. We have to look at education and quality education. And we have to look at poverty and food security and water security for us to realistically be able to handle another pandemic and to handle pandemics in the future. So I think, if anything, it's an affirmation of the importance of the SDGs. Do I think the SDGs will be met by 2030 is a very fair question. I don't think so. I think there is such a concentrated and necessary effort to focus on the SDGs, but I also think it's very human to say, this is a huge issue, let's focus on it. And so I do see the next 2 to 3 years, especially as this consumes our daily lives. I mean, there are people who have been working from home for 6 months and haven't left and don't really get to talk to anybody. And there are conversations we need to have around community and loneliness and mental health. And there are, families where their children are at home and they're not going back to school and they don't have daycare support. So they've had to cut hours at work and they still find themselves overwhelmed. There are people who haven't seen their parents or their grandparents in 6 to 8 months in order to protect and care for them. And so I think it's difficult when people are so consumed for us not to have compassion and say, I recognize that this pandemic is first and foremost on your mind. For families that have been furloughed or for families that have chosen to leave their jobs because they just felt overwhelmed by all of the different moving parts. I do think that if there has ever been a time for us to have empathy and say, okay, I understand this is hitting you hard. This is hitting our collective community hard. We'll focus on this because it's consuming every single hour of our day. And then we can get back to some of those larger global conversations when people feel safe to have those conversations. I think that's fair. And I think it does a disservice to one another when we say, okay, everybody, let's talk about this, when people just aren't there. And it's very understandable.
So then getting back to maybe COVID, how long do you, in your professional opinion, do you think people need to be prepared to deal with this? There's talk of 18 months. Is 36 months more realistic? What is that kind of short-term period that we need to prepare for?
So I think this is, and here is where the conversation of, I think, privilege comes into play quite a bit, actually. I personally lean more towards 36 months. I lean more towards a longer time frame, and that's because I recognize there are serious logistical challenges and infrastructure, manufacturing and delivery challenges to being able to supply a vaccine to everybody. I do think within 18 months, if we have an effective tested vaccine that health professionals have said is safe for use, I do think within 18 months we could potentially have it for those who are most vulnerable. But that would be in certain countries, right? That's in the United States and Canada and Europe. That's definitely not in a lot of middle and low income countries. And so what we're looking at is, I think, a much longer time frame for it to be able to be used by everybody, to deliver to everybody, and also I think a much longer time frame to be received in lower and middle income countries. And so I think globally we're looking at a longer course than we've previously believed. The one thing I'll also add here that I think is really important is there is, some people have said, okay, by, late November, we're going to have a vaccine, or by, and that, military will deliver it. And I have to be very, I'm going to outline, I think, something we've seen in previous pandemics, but something we know to be true, which is the securitization of health. And that oftentimes when we do activate our military to be able to deliver vaccine or health support, it can actually have catastrophic outcomes. The military, for particularly in communities where security services are not seen as a positive, particularly in countries where there have been previous civil wars and conflicts, activating military to disperse vaccines can have really negative effects and can actually lead to increased tension and conflict. And we saw that again with the Ebola pandemic. And so it's something that, many governments are now having a conversation about, okay, how do we effectively deliver this within our own communities? And that's constantly come up, and we've had to say, look at history. This is potentially not kind of the silver bullet that you think it is.
It's amazing the vantage point that you have to think that there are lessons to have learned. I mean, I think that's clearly something that has surfaced, is that people had the privilege, as you say, of not realizing the depths of pandemics that have already taken place, right? Because this is the first for in many people's lifetimes, a global, and the intensity and things like that. So thinking about people who are on this call who are very specifically focused on food insecurity, you talked about the fact that you can't disaggregate food insecurity from healthcare and from family stress and from the economy and all of those things. So how can people whose livelihoods, whose missions are very focused specifically on food insecurity, they can't do everything, right? So how would you advise them to build partnerships or support their constituents or their the people that they serve, who are facing all of these issues simultaneously?
That's an excellent question, Kathy. And I think it's so true for every field. No one group can do everything. That's, and it is why I really emphasize doing what you can in your community, in your capacity, right? So not all of us are going to be able to actively work on food insecurity. I don't, for example, work at or with a food bank. I don't understand the intimate details of what my community needs when it comes down to nutrition, nor do I understand what's being taught locally to kids about nutrition and food awareness and things like that to kids and families. And so I think there's really a unique responsibility when it comes to educators and service providers within a community. And I do think food banks fall really within that that box, right? You serve as a point of engagement with the community, a significant service resource where families will come to you in their most dire and leverage what you've been able to collect. And I think what's really important there is people trust you. It's a very unique relationship where families and communities trust you. Some families choose to donate. Other families come in the middle of a pandemic, feel that you are a place that is safe enough for them to come to sustain their family. And that's a very unique relationship where you are then afforded a level of privilege as an educator and as a partner through this process. And I think the biggest thing food banks can do is serve as that education point, is really have conversations with families about things like the pandemic. We already know that it has impacted low-income families to a degree that is unheard of for middle and high-income families, particularly in countries like the United States and Canada. And so we know that food banks can serve as a place where families can come and pick up things that aren't necessarily just food. They can pick up, face masks, or they can pick up a better understanding of, okay, how do I socially distance, given that I am a service worker, right? How can I protect my family when I come back home? What can I do differently? What can I do to support my local community in that sense? And then I think beyond that, I remember early on in the pandemic, a lot of food banks were getting extra donations because people really recognized that there were families that were going to be hit hard. And there are traditional food banks that really take that on for their communities. But there are also a lot of primary health care clinics, where parents go for their pediatrician appointments, that have previously had things like, canned goods and macaroni and cheese that families have picked up on their way out of their appointments, that didn't have that same wealth of resources for families. And so I think it's also important for food banks to say, where are families going? Where are families accessing? Where do they need to be in terms of, where are they going in terms of appointments? Do schools need food support? Do schools need some type of hands-on support when it comes to nutrition, when it comes to being able to deliver these services? Can we go to local clinics that are still open for pediatrics appointments and say, how can we provide and support you? Because a lot of those places are not getting the same donations that they once did. And they're not getting that wealth of resources that a lot of more traditional food banks are still getting.
So really emphasis on the networking part of GFN in terms of sharing those resources, partnering with health organizations, putting your families at first and foremost, so that we can think about kind of the myriad challenges that they're facing at the same time. I also love that affirmation, kind of do what you can in your community, in your capacity. That feels really manageable. So that is a great takeaway for all of us. I hope that translated for everyone.
Yeah, I don't think we all need to go out and, I suffer from this myself. I know many of the people in my own family and friend circle do. I don't think we need to go out and say, okay, I'm going to solve every single problem. Like, oh, there's a global pandemic, let me get PPE. Oh, teachers are having challenges, let me make sure all the teachers have these different supplies. Oh, schools are having, I do believe it's unrealistic for us individually to say we're going to take everything on. I think whatever is in your bandwidth, in your local community, and you say, okay, I have a role within my local food bank. This is a responsibility I've taken on, and I'm going to continue to honor this responsibility even in the midst of this pandemic. I think that's exceptional. I really do. I think sometimes let's be honest, it's such a weird time. And it's been a weird time for months. And so we've kind of gotten used to digesting it and saying, okay, like, have you had your meetings today? And how productive have you been? When I think we also have to give one another grace and say, thanks for showing up. It's, we don't know what's going on in each other's individual lives. We don't know what's going on, how difficult it is for some of our colleagues just to show up for work. We don't know what's happening. And I think the most important thing, particularly as we want to build our community, is recognize we have existing communities, we have existing networks, we have existing colleagues and partners, and that it's our responsibility to continue to invest in them. And it's also our responsibility to have compassion for one another as we do that. So definitely don't try to take everything on. Just look at the responsibilities that you do have on your plate, and do your best to continue to honor them through this pandemic, because in that sense, people are relying on you and depending on you. And the most we can do is continue to show up for our communities.
I think that's great advice, because the people on this call are already, to your point, their job, what they've agreed to be responsible for, is so critical. And it just got so much harder overnight, but you all each have your own issues at home with your own families. So I think that feeling of white knuckling that you and your father talked about really resonates with everyone, because people are handling, I have 4 sons, I live with my husband, so there's 6 people on any given day. Someone's feeling more anxiety than others, and the whole unit takes on that stress. So I think that giving people that permission to have that grace is really important.
No, I think it's the only way we come, when we look at really, I think that the greatest moments of strength throughout this pandemic, when we look at the moments that I personally look at and say, this is when humanity really showed up, it is saying we're going to protect ourselves so we protect one another. And that, we're going to wear masks so I ensure that you don't get infected, or we're going to be more respectful of service workers and choose not to dine in restaurants, and be cautious, get our groceries delivered if we can. There are certain privileges there, but we're going to celebrate our healthcare workers, and we're going to applaud them, and we're going to recognize the work that they're doing. I mean, we have had such incredible, to the degree that in my local neighborhood, I remember when the pandemic first started, a group of people got together. They had been baking bread due to quarantine, and they started realizing, okay, all this bread we're baking, we can actually donate. And they started donating it to some of the senior citizen homes in the community that were one of the only things, schools had closed down, daycares had closed down, senior citizen homes weren't getting the same level of support that other centers were. And so I think there have been moments of humanity, and I think in every single moment of humanity, what we've seen is people continue to show up for one another. And that's what we need to continue doing, whether it's 18 months, 36 months, if there's another pandemic in 5 or 6 years. If we learn anything from this as a collective community, it is that we are all 100% connected to one another. And my health is fundamentally dependent on your health. And the way in which you choose to operate in the world, the way, if you choose to wear a mask, if you choose to be, respectful of service workers, will impact their health, will impact their families. And that realistically, and it will continue to impact the economy, and the economy will of course impact our health because it leads to certain stresses or reliefs. And so I think at the end of every day, instead of, and I have a huge problem doing this, we're asking, what did you accomplish today? I think now we need to change our own kind of internal tape and say, okay, so how was I in service of my community today? What did I do that positively impacted others? Even if it's something it seems as simple as wearing a mask. So many people are safe because you do, right? And I really think, especially as more people are becoming fatigued by this, I think we do need to remind ourselves that the precautions we take, that the effort we put into protecting one another does save lives. And on my worst days, I think to myself, okay, how many people are okay because I have been responsible? So I do think sometimes it's enough to recognize that, people have different circumstances, and the best we can do is continue to show up for one another.
Great. So that humanity is definitely, hopefully, something we will take away and take forward. A couple of questions about the role of government and, the limitations of government to really aid, specifically, obviously the people on this call are quite focused on food security or insecurity, and also, your expertise in health. Those are, as we've learned, intertwined issues. What should government rely more on civil society like food banks to bridge some of these gaps? What can we feel hopeful about that our governments will learn?
Hopefully they will learn that they have to rely on civil society. Government is not as far reaching, regardless of how large the government is, and they have to. But in order for you to rely on something, you have to have invested in it. And so it's very difficult to come in the midst of a pandemic and say, okay, so let's rely on civil society, let's rely on our food banks, and let's rely on our local organizations that, focus on gender equality or education, if they've been underinvested and undersupported in for so long. So I do hope that this is a moment where government really realizes that, the building blocks of an effective and sustainable society, a prosperous society, are not solely, a strong economy and a responsive government, that you need to have community services, and those community services do need to be supported. I think it's unfair to, I think it's unfair in a time of crisis to come to civil society and say, okay, so you pick up all the slack if civil society hasn't been supported. And I don't think that's the responsibility of government alone. I also think it's the responsibility of corporations. There is a requirement, if you work in a community, if you benefit from a community, that you work in service of a community and you support local civil society, because we've seen very clearly that the impact that civil society has, especially in times of crisis, is the greatest. The credibility, the reach, the legitimacy within that community, the trust, that isn't easy to build, right? And government hasn't been able to build it in the same way. Corporations can't build it in the same way. And so a lot of communities have really kind of have focused and have, I think, really returned to a lot of their civil society and said, okay, what do we do? How do we do this? And civil society has taken on, food and nutrition support. They've taken on education. They're now taking on pandemic education. They're really kind of doing everything, even things that may have been out of their purview previously. So I wholeheartedly believe that this should be a learning lesson for us all on the importance of civil society, but that it has to be sustained. We can't, it's like going to a hospital in the middle of a crisis that has no equipment and saying, okay, take care of everyone. They're going to come back and say, we don't have the equipment. We've been under-resourced. And I do think civil society has a very unique role to play in society, but that it cannot only be looked at in times of crisis.
Right. And you mentioned corporations, obviously, that I work in the private sector. How can some of our attendees today help make those connections? There is a disconnect sometimes between how a corporation knows how to fit in and where to do the most good. So any advice for our attendees today on how to make those types of connections to engage corporations?
For sure. I think that's such an important question. First and foremost, I do think it's important to look at the corporations that are working in your space, that have publicly said, we're really interested in food security, or we're really interested in maternal and child nutrition, or, I think that's important to recognize where those synergies are. I also think it's really important to look at the corporations that are already working within your community. Oftentimes it'll be much easier to engage them if they're already working in your space, if they have other civil society partners. And then the third thing I actually think comes from the corporation end. There are so many incredible resources that corporations have, incredible employees that are doing such incredible work in their local communities. I do think corporations can reach out to their own employees and say, what are some local civil society organizations that you see active in your community, that you trust, that you recognize? Because at the end of the day, I mean, yes, they're employees, but they're also people in the community. They're also having the same challenges. They're also, having trouble with school or daycare, or, recognizing the challenges of working remotely, or seeing their local food bank go under, resourced and under supported. So I do think it's tapping into that internal expertise and saying, okay, and then asking your employees, who would you like to support? What are some issues you feel very passionate about? And there are some corporations that do this incredibly effectively, albeit they tend to focus a bit more on the donating aspect, where they'll match employee donations. But I think there's, I think we don't talk enough about the impact that companies could have through their workforce. And that, we all work with one another. We all live near each other. Employees from your company probably live in my building, and the impact they could have if they came back saying, the building I live in doesn't really have a safe place for kids to play. Maybe that's something that we could look into if there's a child education component to your CSR. So I think it's important for companies to also say we have an in-house a group of expertise from our own employees. And I also think employees feel a lot more seen and heard and respected when they're a part of those conversations, when we reach out to them and say, what are issues you really care about in your community that you volunteer for? They might come back and say, hey, there's this NGO I've been volunteering with, this local civil society organization I've been volunteering with for years, and I'm so excited that you're interested in working with me. And it might be something as simple, I mean, back in March and April, a lot of corporations would approach saying, like, we have X amount of money we'd like to donate. And a lot of local civil society organizations were like, we don't actually need financial resources. We'd love some support on being able to go remote. We'd love some, expertise on financial reporting. We'd love some support on how to be able to deliver things that is safe and secure in our local community, things like food and nutrition. And it was interesting to see a lot of corporations show up and say, oh yeah, no, we actually have that expertise. And we have employees that would love to volunteer to help you get everything online and connected. So I definitely think that companies need to also take a bit more responsibility in the relationship.
Great advice. There are a lot of questions about the role of women, how, women as the nucleus of our families and our communities, how this is impacting them, the role that women and girls can play in addressing hunger issues in their community, how hard women have been hit. So questions around what's an example of a healthy program with an emphasis on women? How can people on this call better support the women in their communities? Keeping in mind a point you made during your remarks, we're already focused on gender equality, right? So there was already work to do in that space, and this is just hitting women even harder. Okay. So maybe you can just talk about women and girls for a little bit.
I mean, the pandemic has set women's rights back and gender equality back by over 4 decades. And so, I think one of the most impactful things we can do is recognize that we work with women, and recognize that in our own jobs, and it's happened multiple times, in meetings I've been at, where I do think there needs to be a recognition that we have to provide, and this is something, again, I do call to corporations and government to a degree for, but really corporations, there has to be support when it comes to childcare and be it if it's financial or if it's flexible working hours, particularly at this time. If you have, a hypothetical is a colleague I work with who has 3 kids at home, and is still expected to be in every meeting. And she's been quite honest about how that's incredibly difficult. She's a single parent, 3 children, and her and I have had conversations where she said some days it just feels untenable. It feels like this isn't where I need to be right now. My kids can't go to school. I really do need to focus on them. And their local school district had opened and then closed because of the pandemic. And so that reprieve in school has often acted as a reprieve for parents to be able to send their kids and then go to work. That's not our reality right now. A lot of people are at home all day with their children, and they're trying to juggle a full-time job with full-time parenting. And it is incredibly unrealistic. And we're seeing the numbers. I mean, we're seeing women academics researching and publishing less historically than they ever have in previous years. We're seeing record numbers of women quitting their jobs. And the reality is that unless we create some sort of support structure, unless we start saying, okay, companies are going to do something like a 4-day work week, or like flexible working hours where it's task-based instead of time-based, I do think we're going to continue to see that. And I don't have any incredibly simple answers. Gender equality has been something we've been struggling with for decades. And I think, if anything, this pandemic has come in and really shined the light on where, gender equality, racial equality, socioeconomic equality, where we really have inequalities throughout society. And there is no, I think, there's no easy checkbox where we say, okay, we're going to do this one thing and suddenly women will be comfortable back at work in the numbers they previously were. They won't feel like they need to quit for community reasons, societal reasons, and familial responsibilities. I just don't see that happening. I do think it's a lot more systemic. And I think until we start creating the necessary structures at work that support women being at work in the home, where we really start talking more about domestic violence and women's safety, which we have not spoken up enough about in the past, and it's been a silent pandemic for years. Um, and I think even more generally, when we start looking at kind of the response when it comes to healthcare workers, predominantly women, frontline responders, service workers, really, I think the backbone of what has gotten us through as a community, has gotten us through this pandemic, has been women. And they often work in lower income jobs. They often work in service positions. They often work in positions where they have a lot less control and authority over their own time, um, their own bodies. And I think that's an incredible disservice to women. So I think there's so much that we already knew existed, but this pandemic has really exacerbated and amplified, that we can look at and say, okay, we need to do better. Now, are there existing, there's incredible existing organizations that are doing work for women, where women are leading and I think doing incredible work in the community. And we already know that. We know that a lot of the civil society organizations that have been engaged since day one in communities are led by women. And we know that, as I had just mentioned, a lot of the service workers and healthcare practitioners that have really gotten us through this pandemic and continue to get us through this pandemic are majority women. So I think we have to be clear that the reality we're seeing of more women leaving work, and the impact on gender equality doesn't match the work that women are doing in our communities. And that's always been true for gender equality. That's no different than what we've historically seen.
So continued work in this space. We have had a few questions about global variations on the impact of COVID, and so maybe you can talk to that specifically. We did have a question from Kenya as well, in terms of how do you deal with a situation where food insecurity feels even more acute? So maybe just zoom out and talk about the global variation and any insight you have specifically around our really vulnerable developing countries.
It's an incredibly important question, mainly because it's the majority of countries that are impacted by food insecurity have been hit incredibly hard throughout this pandemic. So if everybody can kind of imagine their own individual food bank and the insecurity they've had over the past few months of, okay, so we'll get significant donations or support this week and then we won't for a couple of months. Imagine that on a community level, in a community where there isn't necessarily anybody to donate, right? And you're looking at a global and international community, international development space that has been, really debilitated by the pandemic and can't necessarily show up for your country or for your community. And so I think it's a very important question. It's something, when we talk about kind of the way in which our international development space operates, it's a question that we've been grappling with a lot the past few months, because it is inherently unequal in many ways. And that basically means that, when the international development community is hit hard by something, in one region, it does mean that, okay, a lot of that support that goes to a lot of developing low and middle income countries ends up being stopped right at the tap, right? And so it becomes a lot more acute. It becomes a lot more unseen, if that's the right word, where, we previously may have been talking about famines or food insecurity in other countries, and we realize, as people are now grounded in their homes, working remotely, and focusing on more local issues, a lot of that conversation, that global lens stops. It is one of the reasons that I thought it was really important that the World Food Program was recognized this year. I do think the work that they do is incredible. It has always been, but I think in a moment of a global pandemic, they really have been one of the only outlets for the global community to be able to donate and disperse resources in countries that need it the most. And there is no doubt that there's no one organization that has the ability to reach everybody. But the fact that they continued to operate amidst the pandemic, they continued to work. Most of them are local country employees. They're, people who really were members of their community, standing up for their community, working through the World Food Program, I think was incredible. And I think is an example of what we all do need to be doing throughout this pandemic, is recognizing that we have taken on responsibility in good times, in safe times. We have taken on responsibility, and in insecurity, we have to honor and uphold that responsibility. So World Food Program is one that I really admire. The second thing is, I do think this will be a moment of importance for many countries, looking at what their governments have provided for them and continue to provide for them. And I think it should be. And what I mean by that is, the budgets will never come up in many low and middle income countries to the degree where the government can provide healthcare and infrastructure and response to climate and education and employment and skills training. It won't, right? In many countries, there does need to be ODA support. There does need to be international funding and development support. And international financing. And so that's a reality we live with, but it does mean citizens, I think, need to be asking more questions about where the money is going, what is happening, what is our government responsible for, or our local representatives responsible for, and are they meeting that? Are they actually honoring, what promises have been made, and where, if you do pay taxes, where those taxes are supposed to be going? I think that's a question that's come up a lot in many low and middle income countries, where things like, primary healthcare facilities didn't have electricity, and citizens were saying, no, this is something that should have been funded. This is something that should have been supported. So I think we're going to see a lot more local civic engagement, but I think a lot more local political engagement, where we're going to have people saying, okay, we need to do better. And that's something we've seen with protests around the world, where citizens are calling for a better distribution of resources, saying, you are putting millions of dollars into this, which doesn't protect me and actually makes me feel unsafe. Why isn't it in, healthcare response or something like food and nutrition? So I think we're going to continue to see that.
So we're nearing the top of our time together. So I want to make sure that we have kind of a lesson learned type question. Where are the opportunities to come out of this better? Especially, we had a couple of questions, and I think about this a lot. Young people, I mean, this is a really transformational experience for a lot of them that should inform their views on civil society and healthcare and role of government and all of these things going forward. So what are let's make sure we keep it hopeful. What lessons do you hope our young people and our future leaders around the world, many of whom are probably on this call in these really critical roles, what do you hope they learn and take forward?
I'm actually incredibly hopeful. I have two younger sisters, both in one in university, one in high school, and I'm incredibly hopeful. I think there are a few things that have made me incredibly hopeful the past few months. I think young people, and I won't even say young people, I will say, I think everyone has shown themselves to be incredibly resilient. And I think have shown themselves to be, team players in a way that we have not been called on to a lot in our society. I think beyond that, for young people in particular, it is a transformational moment for sure. But the way in which they have shown up protesting for things they believe in, and I think reduced inequalities between people, between nations, is the single most important determinant of who receives care and what kind of life that you get the privilege of leading. And I think the fact that they have stood up so unequivocally globally, no country has been untouched by their voice, I think is incredibly powerful. And I do think tells politicians and tells companies and tells communities, the status quo simply doesn't work anymore. And so I think that's incredibly important. And I think that will continue to be something that they feel, because there is an insecurity that comes with the pandemic. When you do see your parents making an active choice about whether they should go out to work or, and whether you can be fed, or whether they want to keep their family safe. And so I do think a lot of people are seeing that in their own homes and saying, okay, how can I stand up for a better world? How can I, voice my opinions on climate change? How can I talk about gender equality so the next pandemic doesn't completely wipe out decades of progress? So I think that's incredibly important. And the third thing I will say is, I think as a global community, we're having more honest conversations about mental health. And I do attribute that a lot to young people. I attribute that to a recognition that this, it does take a village. And this idea of, um, this idea of kind of being able to insulate and only do things on your own isn't realistic. And this pandemic has really highlighted that for a lot of people. And it's been a lot of people who've been at home, alone throughout this pandemic, who've said, I can't do this. It's been really difficult. And companies are now having, I think, more honest conversations about mental health. Governments are having more honest conversations about mental health. And, in countries where mental health is seen as a taboo, where we're talking about this is actually quite difficult, I think we're really opening the doors and having honest conversations about the impact that this can have on people, and how it is a responsibility. If we're talking about healthcare, we have to be holistic, and it's not just about a pandemic. It's also about how do we take care of one another, in terms of our emotional and mental health. So I'm incredibly hopeful. I really am. I think, we're not the first generation. We're not the last generation that has lived through a global crisis. And crises take different shapes. This one came in the shape of a pandemic. And I think we probably have a lot of people who have been living through this who have decided they're going to get involved in something like healthcare or policy um, or epidemiology, or that they're going to be actively engaged. And I think that's actually when you get your most incredible and impactful change makers, when they've lived through the worst of it and realized it's not that hard to do better. So I'm going to start doing better.
That's great. That's a great way, I think, for us to end our talk. You have just such a depth and breadth of expertise. So thank you so much, Dr. Murabit, for sharing your time with us today. It was really great to get to know you and spend time with you. This was a great conversation. I also want to thank everyone for being engaged. We had so many great questions. I wish we could all be together in a room sharing voices. Hopefully that will come soon. On behalf of GFN, I want to thank the FBLI sponsors, including General Mills, HEB Brambles, Cargill, the DLA Piper Foundation, Fundación Alaa, and Ingredion. Later today, you will receive an email from GFN with a link to a short feedback survey. Please do take a couple of minutes to complete that so that they can ensure that we improve our sessions and give you the kind of information you're looking for. And you'll also get a link to the video of today's session, and you can share that with whoever you want. So Dr. Murabit, thank you for your work. Thank you for your time today. Thank you for your insights. Thank you to everyone on the call. You're doing such important work, and it is really appreciated. And I really am grateful to have had this time to be with all of you. And I hope everyone has a wonderful day, week, rest of the year. Take care.
Thank you so much, Kathy. Thank you all for being here. I hope you guys have a lovely day. Take care.